Kosum, and I will be presenting on the role of Stemwave therapy in chronic pain management and evidence based practice inquiry. Chronic pain is a widespread social health problem that impacts over 51 million adults in the United States. This makes it one of the most frequent cause of individuals seeking healthcare services. In addition to the physical discomfort, chronic pain is a source of emotional distress, limitations in aspects of functions, and high costs to patients as well as healthcare systems. NSAIDs and opioids are pharmacological agents whose use is resorted by many and are, however, only temporary and lose their effectiveness with time. These restrictions point to a higher demand for safer and more sustainable methods of pain management. With the evolution of healthcare in the direction of non invasive and patient centered treatments, the existence of particular therapies like extracorporeal shockwave therapy, which is commercially called the Stemwave therapy, has acquired more significance. This presentation discusses how Stemwave therapy can be used to manage chronic musculoskeletal pain as an evidence based intervention using a comparative approach on Stemwave therapy and available physical therapy options. This project attempts to determine the efficiency of the former and the lessening of pain, enhancing function, and the reduction of opioid drug dependence, which fits the latest objectives in nursing practice and value based care. So, the significance of the problem: chronic musculoskeletal pain is a huge burden on healthcare systems of the U.S. It is estimated that the system loses both medically and loss in productivity are close to $635 billion per year. Among others, plantar fasciitis, rotator cuff tears, and chronic lower back pain are conditions with severe disability outcomes on mobility and the quality of life. These limitations can affect the ability of patients to work, participate in day to day activities, and live independently, particularly among the elderly. This is an issue that needs to be solved, which is why it will result in improved outcomes for patients and reduce healthcare expenditures in the long term. Opioids are also a widely prevalent used in treatment chronic pain management, which is also why the nation is also having an addiction crisis, highlighting the significance of using non-pharmacological options. Stemwave therapy proves as a non-invasive approach which the acoustic pressure waves are sent in order to promote the tissue reconstruction. So what it does is a cellular regeneration response. So it tells the good cells to regenerate where the bad cells are at and improves blood circulation, and it controls the transmission of the pain. Studies have revealed that patients are undergoing this type of therapy and they have dramatic increase in decrease they had a dramatic increase in pain and functionality as compared to conventional ones. A decrease in in pain and functionality. They have an increase in functionality but a decrease in pain. These results favor its increased significance in modern nursing practice. So, my peacock question is: in adults with chronic musculoskeletal pain, does Stemwave therapy, in comparison with standard physical therapy or ultrasound therapy, reduce pain and improve outcome functions with a timing over 4 to 6 week period, and it focus on non-invasive patient-centered care? Does this address the gap in chronic pain, and they have a better outcome? Population intervention details. So, the population to be targeted in this practice is adults aged 18 years above, diagnosed with a chronic musculoskeletal pain condition, typically conditions diagnosed including plantar fasciitis, Achilles tendinopathy, rotator cuff injuries, and chronic lower back pain. These pathologies frequently lead to chronic pain, functional dysmobility, and dependence on drugs. This population of patients is also likely to pursue alternative pain treatment methods following a minimum response to conventional treatment methods. Stemwave treatment is used. Stemwave treatment is the use of radical or focused shockwaves to the injured soft tissue, which activates a biological mechanisms, and the tissue regenerates in response to the treatment. Those mechanisms contribute to a decrease in inflammation, changing the perception of pain, which reduces better clinical outcomes. This intervention can be performed at home, so it's non-invasive in nature, and the intervention is especially convenient in the case because the devices are portable and can be administered easily. Stemwave therapy helps patients achieve safer management of pain because of less reliance on the long-term pharmacological treatments and in compliance with nursing objectives to achieve functional recovery and self-control. So, conventional treatments used in comparisons, conventional treatments use chronic skeletal muscle pain, usually involving the use of therapeutic ultrasound, stretching exercises, and manual therapy. Although these interventions still play a central role in physical rehabilitation, they have been shown to only have an overall negative effect on recovery and reduce long-term outcome in chronic conditions. Patients can be subjected to lengthy treatments and can still be faced with chronic pain and limitations of functional capacity. Validated pain and functional assessments measure are commonly used to measure the outcomes in relation to the shockwave therapy. The degree of pain is established through the VAS, which is Visual Analog Scale, and the Numeric Pain Rating Scale, the NPRS. On the contrary, the functional outcomes are assessed with the assistance such as a scale of lower extremity functional scale, which is the LEFS, and the FS-36 health survey. Research shows that the stem wave has shown to have a better reduction in pain and improve short-term functionality within 4 to 6 weeks compared to the traditional treatments. You gotta see this machine; it's amazing. These results justify its success in being a non-invasive alternative. So my search strategy, I did PubMed and Google Scholar and CINAHL, and then I also had keywords such as ESWT, stem wave therapy, and chronic pain. Inclusions were adults, English. The I researched articles from 2018 to 2025, and they were peer review articles. And exclusions were pediatrics, animals, and unrelated outcomes. I had 73 articles initially, 15 with full text reviewed, 10 articles were included in this evidence synthesis, and randomized controlled trials and systematic reviews were analyzed. So, the literature synthesis of pain reduction. So, several studies have indicated that the extracorporeal um, shockwave therapy, which is stem wave, is more effective in musculoskeletal patients with chronic pain as compared to traditional physical therapy. The findings demonstrated that the patients undergoing this shockwave therapy had a statistically significant pain and quality of life improvement as compared to those who did not receive the therapy. These findings are consistent with those and that have been previously reported, which has shown rapid analgesic response following the Stemwave procedures. Um, they learned that the patients with plantar fasciitis who received the shockwave therapy had a faster and more pain relief as compared to the patients receiving ultrasound or exercise therapy. In addition, the data supported that the shockwave activity by reducing the degree of pain in a variety of musculoskeletal alignments. The patients also reported a decrease in the required analgesic therapies, satisfaction with care, and emphasize on clinical and practical benefits of non invasive interventions. These results confirm that the Stemwave format of therapy should be utilized in managing chronic pain due to its being cost effective and well tolerated. Besides improving the patient's shockwave therapy, it has been also proven to pose functional results through mobility and improvement of patients with chronic musculoskeletal pain. Function measurement scales such as the LEFS and the SF-36 have demonstrated clinically significant improvements in shockwave treatment. These include indicators of improvements in terms of physical performance, a rise in extent of activity, and a quality of life improvement. The gait parameters of the plantar fasciitis patients were particularly examined, and they found that there were considerable improvements in the patients following the shockwave therapy. Better gait patterns reduced the rate of falls and gave a greater degree of autonomy, particularly among the aged. Shockwave will also work better with home based rehabilitation models as opposed to traditional therapy, such as therapy is more rapid in the recovery of functionality. These findings suggest that overall rehabilitative value, such as stem-wave therapy, and support the integration of a ladder into the care pathways that has restored mobility and functioning. So the mechanisms and application. The treatment stem wave shock therapy is done through a mechanic and biological actions that improve the healing process of the tissues. These acoustic waves activate a neurovascularization, angiogenesis, and cellular regeneration, which promote healing and pain management. These processes have rendered shockwave as a distinct modality of those traditional modalities, the primary focus of which is to treat the symptoms rather than reconstruct the tissue. The literature contributes to the utilization of radical and focus on shockwave devices in a vast array of musculoskeletal disorders, including tendinopathy and chronic damage to the soft tissue. The average duration of regular treatment regime is 4 to 6 weeks, which enables the observation of results and assessments of clinical outcomes regularly. The choice of the patient is the appropriate dosage, however, will help to get the optimized results. There is a stressful emphasis on the use of individualized treatment planning as the process to ensure consistency and effectiveness is an evidence based approach to clinical practice and is justified. The synthesis matrix gives a summary of key results between the studies and were included in the offers of evidence that is in the line of the use of the extracorporeal shockwave therapy and chronic musculoskeletal pain. Both of the studies demonstrate the pain and functional results experienced in significant reduction compared to the traditional therapies, such as the report faster therapeutic responses among the groups that underwent the shockwave therapy. Additional evidence was listed the um, in the 2021 and 2024, which on this chart, which cited that shockwave therapy regeneration is not invasive. The 2023 article increased the consistency of the outcomes undergoing the numerous circumstances. But the 2024 article focused on the gait and mobility improvements. The patient preference and the patient satisfaction was the quantitative results. And the above mentioned findings present powerful and consistent evidence that suggests that stem wave therapy is an effective patient-centered intervention when it comes to managing chronic pain. Description of settings. So the proposed change in practice will be implemented at We Care Home Health Agency, which is my practice. It's a private institution offering non-invasive pain management to services to adults with chronic musculoskeletal illnesses. The client of the agency is a very diverse market that encompasses the age with degenerative joint disease or disorders and individuals with chronic soft tissue injuries. There is a delivery of care by licensed physical therapists and certified medical assistants in a multidisciplinary process. We also have RNs on staff that also administer shockwave therapy, stem wave therapy. Um, the home-based care model is a good environment to administer stem waves since it provides an operating environment for undertaking treatment. The shockwave machines are handheld devices. It's actually a machine, but it's a device that you hold in your hand. But the machine is not that heavy, and it is portable, and it provides the clinicians an opportunity to apply the therapy to the patient during routine visits. Electronic health records aid in the monitoring of pain evaluation, functional outcome, and adherence to treatment. This type of infrastructure contributes to the introduction and evidence-based practice and enables the structured evaluation of the patient outcomes, which aligns with the principle of patient-centered high-quality care created by the organization. So the plan change process is guided by the eight-step model, establishes urgency via pain management data, is form change coalition clinical and administrative leaders. We have clear communication vision to all staff. We have targeted training on stem wave implementation, and we celebrate short-term wins with patient outcomes and reinforce culture through success stories. The evaluation of plans. The practice would be evaluated using reduction of pain, functional improvement, and compliance with treatment protocols. Um, the VAS and the numeric pain rating scale will be used to measure the pain before and after treatments. Lower extremity functional scale or surgery specific tests that are pertinent to the diagnosis of each patient will be used to measure the functional outcomes. The process of adherence will be monitored through recording and achieving the 10 to 12 therapy sessions. To assess the progress, outcomes will be measured at baseline, mid-treatment, and post-treatment. The clinical meaningful improvement is considered to be 30% decrease in pain and 20% improvement in functional scores. These standards are justified by existing literature and offer objective standards of assessing effectiveness and driving constant quality enhancement. The data will be collected by performing standard home visits and recording in an electronic health record and database system of the agency, which is a secured system and is HIPAA compliant. The use of the de-identified data in evaluation and reporting will require an informed consent from the patients. The confidentiality will be ensured through the compliance of HIPAA regulations, and the ethical treatment of patients' information will be provided. In the analysis of the data, peer t-tests will be employed to suggest a comparison of pre and post intervention pain and functional scores when data are distributed normally. The non-parametric data will be tested by the Wilcoxon-Sign Brink test. The rates of adherence and patient satisfaction will be summarized and will help of descriptive statistics. It is an analytical method that would enable proper evaluation of the effectiveness of the interventions and facilitate the use of evidence-based decision making in this organization. Practice recommendations. According to combined analysis of high quality, the introduction of Stemwave therapy into chronic musculoskeletal pain management practices in the home health care and outpatient setting should be considered. The studies show that pain is considerably reduced and functional outcomes are improved in relation to the shockwave therapy. The randomized controlled trials and the systematic reviews support this recommendation and make it the highest level of recommendation, and level A, which is based on the Johns Hopkins nursing evidence-based practice model. The value-based care and reduction of opioid use are consistent with the non-invasive and patient-preferred quality of Stemwave therapy. The fact that it has a high degree of feasibility and can be transported to different healthcare environments also contributes to its widespread usage. Plan for dissemination. The distribution of findings will be conducted by internal and external means. Um, to enhance sharing knowledge and practice. In-house findings will be distributed in the staff meetings and agency newsletters. Dashboards that present aggregated outcome data will be used in electronic health records to facilitate transparency and continuous learning. On the external level, the results will be provided at a local and regional healthcare conferences and published in professional networks of nurses and rehabilitation centers. Peer-to-peer education will promote a wider use and debate of best practices. Application findings into organizational care guidelines makes them sustainable and promotes the improvement of evidence-based practice in an entire healthcare community. So the conclusion. The problem of chronic musculoskeletal pain is a major social health issue with far-reaching consequences in the patient healthcare systems. Stemwave is a non-invasive and evidence-based intervention that is proven to have beneficial effect on pain reduction, mobility improvement, and quality of life. Its capacity to lessen dependence on pharmacological intervention is associated with major concerns about the use of opiates and long-term medication risks. As a leader and a clinical practitioner, Stemwave therapy implementation would comply with the principle of patient-centered care and the organization objectives at We Care Home Health Agency. Valuable results in the pain and functioning among the patients who went through the suggested treatment course supports the usefulness of the intervention. Further validation of the evidence base through ongoing review and further studies prolonged effects will benefit further application in intervention in healthcare environments. Here are my resources, and I thank you for listening to my presentation.